LSW, so I'm a licensed clinical social worker. And I have been working at the Montrose Center, formerly the Montrose Counseling Center, for about 13 years. This year will be 13 years. And I've done a bunch of different things, positions since I've worked there. I started out working as a health educator. So I did that for about 5 or 6 years, and we have a grant from the Texas Department of Health that allows us to go into all the alcohol and drug treatment centers in the Houston area that get state funding, and we provide them with health education for their clients. So I did that for many, many years. Did HIV testing, hepatitis C testing, taught classes, that kind of stuff. And then we got a grant that I was on for about 3 years, and that was a federal grant that siphoned through the City of Houston Health Department, and we won the bid for it. And that was an outreach grant specifically targeting the MSM community. Does anybody know what that might be?
Men having
Right, that's what the government calls gay, because they don't use those words. And at first I was really kind of like, what the hell? Why can't they just say gay men or bisexual men? But there's actually a lot of men out there who have sex with other men who don't identify as gay or bi. They identify as straight, but they might have sex with other men from time to time. So it kind of makes sense from a more analytical standpoint to classify things that way. So I worked on that grant for about 3 years, and it was really interesting. We went into, I was going to all sorts of places, nightclubs and bars and street outreach and high prostitution hotels, and my mom was like, "What the hell are you doing?" I was like, "This is fun, right?" And so what we do is we targeted 5 zip codes in Houston that had really high HIV and STD rates. And so I would go in there and I had a partner, a team partner, and so we would go in together and find out in those neighborhoods and those specific communities who were the gatekeepers, who were the people that kind of knew what was going on, the people hanging out in front of the corner store, the guy that was at the bar stool every day at 5 o'clock, that kind of stuff. And so we went in and kind of examined these communities, kind of built rapport with them, and they in turn became peer advocates for us. And so what peer advocates did is we would supply them with certain materials, and then they would distribute them to the people that they would come in contact with. So if it's like, Friday night and hello, you can come in. If it's like a Friday night in 3rd Ward or something, and I'm hanging out on the corner of Live Oak and McGowan, and there's some guy that's like coming up to me, and I'm like, "Hey, do you want some free condoms or whatever?" He's probably gonna think I'm a cop, right? I'm not necessarily blend in that community. But if the message and the information is coming from someone indigenous to that community, someone who people see all the time, they're much more likely to be receptive. So we kind of embrace that model. And then we would create these little, what we call zines, these little stories. And we would find people in these communities, interview them, change their name, change their identifying information. And we would try to highlight one of the stages of change. So there's 5 stages of change that people typically go through before they make a behavioral change. So it's like pre-contemplation, contemplation, action, maintenance, relapse, right? And so we would try to find people that made some type of stage of change that was really positive in regards to their HIV and STD risk factors and substance use. So we would create these little stories, print them up, they're really nice. We put them in our safer sex material kits, and then we would recruit those peer advocates to go distribute them. So it's kind of an interesting program. The idea was to reduce those rates in those specific communities and to kind of get that positive vibe out there. So if I'm hanging out at the bar on Wednesday night and I see this little pamphlet and there's this thing of condoms and this other stuff, and I pick it up and I read it, and that person's like me, they're my age, they look like me, we go to the same places, they have the same lingo, I'm much more likely to be responsive and receptive to that than something like a real generic poster on the wall or something like that. So the idea was to kind of get this vibe in the community that, hey, if someone like me has made a change, maybe I can too. So I did that for about 3 years. Then I went back to school, got my master's degree in social work, and did my clinical internship at the City of Houston Health Department, and then at the Montrose Counseling Center. And then since then I've been a staff therapist. So a lot of the clients that I work with are folks who are either newly diagnosed with HIV or have been long-term survivors of HIV/AIDS. And then I see a lot of people who have nothing to do with HIV. People just come in for depression, anxiety, relationship stuff, kind of things that you would see any kind of counselor for. And we see the homeless population. I see a lot of people who are indigent, a lot of people who are uninsured, all the way up to people who are, got bukus of money and everywhere in between. So it's really kind of an interesting caseload that I have. And I really enjoy kind of working with all sorts of different types of people. But HIV services is one of the top services that we provide at the Montrose Center. So I came here today kind of commemorating World AIDS Day, which was on Monday, to talk about HIV. And I think it's something that definitely needs to be talked about. It's not always something that's on people's radar. A lot of people know the basics of transmission and stuff. And a lot of people know someone who's HIV positive. But beyond that, people just don't sit around and talk about it all the time, right? So it's nice to have these kind of forums and days to kind of commemorate it, to make sure that we continue to discuss it. So we always get, you guys are front of well, we always get statistics and data typically a year or two later after it's all been compiled. So this is all statistics and trends that were most current as of July 2012. So data has shown that Texas has the highest teen pregnancy rate in the United States. Go Texas. 1 out of every 5 people infected with HIV don't know that they have it. So about 20% of the population is HIV positive and don't know that they are infected with the disease. Every 9.5 minutes, someone is infected with HIV in the U.S., and African Americans make up only about 13% of the U.S. population, but they account for about 52% of all new HIV infections. So that's extremely disproportionate to the rest of the population in that in the Black community. 27,650 individuals in 2012 were known to be living with HIV/AIDS in Houston and Harris County. So we have about 30,000 people in Houston that are HIV positive that we're aware of. So HIV is one of those trackable and reportable diseases, right? So if you show up positive, if you come to me and get an HIV test, by law I have to report that if it's positive to the health department. So they kind of keep these tallies and come up with these numbers and all that kind of stuff. So it's about 30,000 people in Houston, and Houston has one of the higher rates of HIV in the country. So it probably typically goes down by population. So typically like New York, metropolitan area will probably have the highest per capita. Other cities that sometimes people are surprised by, Washington, D.C. has an extremely disproportionately high HIV infection. Atlanta has a really high HIV infection. And then the other big cities, Houston falls in about number 7 as far as numbers go. And about 75% of all reported STD rates in Houston and Harris County were among 15 to 24-year-olds. So a lot of this is happening to younger people, and a lot of people are becoming infected with HIV who are young. 1 person in Houston is infected with HIV approximately every 7 hours, and 1 out of 53 African Americans in Houston are living with HIV. So we have this kind of old mentality that the only people who are at high risk for HIV are white urban gay men, and that's completely not the case. Locally and regionally, what we're finding out more and more is this is a disease that's oftentimes affected by people of color, specifically women of color. So Latino and African American women are at a really, really disproportionately high risk factor right now than ever before. There in Houston, there's an organization called Omega House. It's part of Bearing Omega Community Services, and that's like the AIDS hospice in Houston. And about 10 years ago, I volunteered there a couple times, and you'd go into that building, and I'd probably say the majority of people that were residents there who were in the hospice dying of AIDS were probably white gay men in their 50s and 60s. It was a pretty accurate general picture. Most of the people now at that same hospice in 2014 are black women in their 30s and 40s. So we're seeing a much different picture of who is contracting HIV and then also who is dying of AIDS. It is becoming more of a chronic, manageable disease than ever before, but that's typically only if you're on meds. And there's a lot of people who don't have access to the medication. And then, like we said a second ago, there's a lot of people who don't even know that they're positive. So I want to give you guys a little bit of history of the virus. I always think this is interesting. Just because we've come so far, there's been a lot of interesting things happen. And then I'm going to talk a little bit about mental health issues surrounding HIV, and then I'll wrap up. In June of 1981 is when the first appearance of what we would now call HIV was first documented. So June 1981 is when all this kind of came about. And what occurred was that there was a medical journal called the MMWR, which is the Morbidity Mortality Weekly Report, and this is very pre-Google, pre-internet days, right? So if you were a physician or some kind of healthcare worker and you lived in the United States or you lived abroad, this was a journal that you would often find on a physician's desk or a medical student's desk, and basically it would highlight interesting cases. It would talk about new trends, new medications, things like that. And it was like a journal, medical journal. And in July of '81, this case was reported and published, and this marks the beginning of what we now call the AIDS epidemic. And what had happened is that there was a physician in Los Angeles who was taking his medical students on rounds, and there were 5 patients, all with very similar symptoms, who were all young gay men in their 20s and 30s, who were all dying. And it was very, very strange. And they all were showing up with pneumocystis carinii pneumonia, which is a very, very rare type of pneumonia. And typically when people are exposed to that, oftentimes it's fatal. And so all these men were all previously healthy. They had no prior medical history. And suddenly they all became stricken with it, which is a very rare type of pneumonia. And they were all gay. And they were all dying. And so this was definitely kind of a vignette that was very interesting. And back then we didn't have a name for it. So they actually called what we now call HIV/AIDS, it was called GRID, or gay-related immune deficiency, because it was thought that it could only happen to gay men. So the first cases were identified to gay men, and so this was kind of where that stigma arises. So a lot of people still think that, you know, if you're gay, if you're between a certain age range, you live in a certain town or geographic area, that you must have HIV, right? A lot of times people still pigeonhole people like that. But '81 is when it all started happening, and then the next populations we started seeing it show up in were the Haitian population. At that time in the early '80s, there was a really big group of Haitians coming up through South Florida, immigrating. And then we also then found it in the IV drug use population. So people shooting up needles, particularly at that time, it was probably speed and heroin. And in 1982 is when the term AIDS came about. So that's when people started talking about it. But before then it was GRID or gay cancer. You would oftentimes hear people say that. In 1983, it was discovered that heterosexual people were getting it who didn't fit into those other categories, and that's when people started to freak out. They're like, oh my God, normal people can get this disease. And so that's when people started taking action, because before then, it was just the gays, right? Who cares about them? And it was the drug addicts, who cares about them? And the immigrants, well, we definitely don't care about them. But when it could happen to your child or your mother or your spouse or something like that, that's when people started to panic. And that's when, very shortly thereafter, the FDA approved the first HIV antibody test in 1984. And so all blood products since 1984 have been screened for HIV. So if you went to the hospital and had to have a blood transfusion, you were in an accident, or you had some kind of blood products donated to you, before 1984, a lot of people were exposed to HIV that way. After 1984, that's when the screening started. And at that time in 1984, it was predicted that we would develop a vaccine by the year 1990, which was very wishful thinking. Right, here we are 30-something years later, and we're still not there yet. In 1985, Rock Hudson died. He was a big famous movie star in the 1950s and 1960s, and he was kind of this poster boy for health, for fame, for fortune, for old Hollywood, all that. And he died suddenly in his house, very quietly. And when people found out he died and he died of AIDS, it was like tabloid news. People were like, oh my God, how could Rock Hudson die? How did this happen? So this is when a lot of celebrities started kind of disclosing that they either had it or that it was an issue. President Reagan, who was president at the time, first mentioned the word AIDS in 1985. And there's a lot of political background to that. That was a really touchy thing, because a lot of people were really, really pissed because the government kind of lagged in any kind of response. And he had known about this, we known about it since 1981, and it took him 4 years to kind of publicly even say the word AIDS. And so people were bitter, they're angry, there was no funding, there was no money, people were getting sick, people were dying every day, and people weren't doing anything about it. So that was kind of a big deal. And then in 1985 is when a lot of the organizations started to form. So AMFAR, that is a AIDS research organization. Liz Taylor was a big spokesperson for that. The AIDS Foundations came about during that time. And then Ryan White, whose picture is in that top corner, he was a teenager. He was very young, like maybe 13, and he was diagnosed with AIDS. And he was extremely discriminated against in the little small town he lived in. So he was kicked out of school. People would drive by his house and break the windows and spray paint, vandalize, and they were basically run out of town. And he really, really loved school, and so his mom tried to advocate for him, and so they took it to court, and they won their case. And so his case was like this huge benchmark for HIV/AIDS discrimination, because what was happening before, if someone found out, let's say your landlord, that you were HIV positive, you would be locked out of your apartment. You would be kicked out. Your lease would end. If an employer or at your job found out, they would fire you if they knew you had HIV/AIDS. If someone suspected you to have it, no one would want to touch you, go to dinner with you. People were very ignorant during this time period of the transmission and all that. And so we saw at that time a lot of people who were HIV positive were ending up homeless. They were really sick. There were no medications. They were kicked out of their houses. They lost their jobs, and they were dying. And the hospitals and the emergency rooms were just didn't know what to do. So it became this really, really big problem in the 1980s. In 1986 is when AZT came out. If anyone ever in here has seen the film or the movie play Rent, they often reference AZT. And AZT was one of the very first HIV meds, and it was really, really toxic. People got really, really sick from it. So oftentimes doctors were overprescribing it, and people would get these really toxic dosages of it. And they actually think it kind of contributed to a lot of people's deaths. So this was a really, really big problem. But this was the only medication during that time that was really available. In 1987, ACT UP was a kind of a political action group that was formed in response to the HIV/AIDS crisis, and they would do all sorts of different speaking engagements. They would do protests. They would do all these things to get people's attention that this is like a problem, because people just didn't want to talk about it. And the AIDS quilt was also displayed on the National Mall in Washington, D.C. for the first time. And what happened here was that, let's say you lived in a really small community. Let's say you lived in Dickinson, Texas, right? Tiny little town. And if someone in that community died from HIV/AIDS, they would make a quilt about their life, right? Things to represent who they are, who they were, and then they might take that to a bigger city like Houston, and then Houston might gather them all up, and all these cities across the country brought all these quilts, and they displayed them out on the mall, National Mall in Washington, D.C., and it was this overwhelmingly, like, powerful moment, and they would go up and they would read the names of all the people who perished, and it was like this visual statement of, oh my God, look what's happening. We've lost all these people due to this disease. We've got to do something about it. And if they were to do something like that today, there's nowhere big enough to even like display all the, if there were quilts representing all those lives lost. There's just been so many. In 1988, the Surgeon General, at the time I believe was Coop, he mailed out a booklet to every household in the United States called Understanding AIDS, because there was so much misinformation, and it gave really basic info. This is how, these are the body fluids that HIV is found in, these are the transmission methods, this is prevention, this is where you can go to get tested. Because people had all this misinformation, there's all these rumors, there's all this stuff going along. And so people really just needed to be educated and informed. In 1990 is when the Americans with Disabilities Act was enacted, and included in that was people with HIV/AIDS. So in 1990 it became a protected class. So before then you could be fired from your job, you could be not treated at a hospital, you could be kicked out of your house, but after 1990 you now had federal protection. And this is when they named the funding source was called the Ryan White Care Act. And so this allowed federal funding to provide treatment, medicine, testing, all that. And we still have that today. So here's a kind of a quick, brief image of that quilt. And so all these little tiny pieces are all big quilts, and they're all pieced together at the same time. So pretty powerful statement. In 1991 is when Magic Johnson revealed that he was HIV positive, and this was a really big deal. This is the first time I ever remember hearing about HIV. So I'm going to age myself right now, but I was in, I think, 7th grade, and I was on the basketball team. And I think it was this time, it was like November, December, remember it was cold outside. And our coach came up to us after practice, and he started bawling, crying, you know, those little PE coach shorts on and everything. It was like this really weird memory I have. And he was like, Magic's got AIDS! And I was like, oh, what? And I didn't even know what that was. And I remember going home, and at the dinner table, my parents were talking about it, and it was on the news, and it's like all anyone could talk about was Magic Johnson has AIDS. OMG, right? Like, this is crazy. And so that became this really, really big thing. People started talking about it more. And he was kind of viewed as this very healthy, untouchable celebrity, you know, athlete. And then Arthur Ashe, shortly thereafter, announced that he was HIV positive. He was a world famous tennis player. And then in 1994, I also remember this. I was probably in high school, and that TV show called The Real World. I don't even know if it's on anymore, but they would go in and one of the first reality TV shows, and they had all these young people. They would put them in a house together and like film all their shenanigans. And there was this one guy in that particular episode that season, and his name was Pedro, and he was young. He was like 19 or 20, and he had AIDS. And during the filming of the show, he got sick and died. And so for someone who was like 15, 16 years old, you kind of bond and relate to these characters you think are so cool, and then one of them dies from AIDS. It was like, oh my God, like this is crazy. And so you really kind of would feel that. And in 1994, AIDS became the #1 cause of death for men and women in the United States between the ages of 25 to 44, which was crazy. So people were getting it, they were getting really, really sick, and people were dying like crazy. I've had clients and coworkers and stuff